Yo, 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 what up, y'all? It's your boy Rob coming back at you once again with another live stream. So, before we get started, you already know what to do. If you're not subscribed to the channel, make sure you hit the bell icon twice. Smash the like button, share this video out to all of your followers, and let's get it cracking. All right. So, shouts out to everybody that comes into the room. Make sure that you guys smash that like button. Also, if you're not subscribed, make sure that you hit the bell icon twice. Take a moment, make sure that you follow me on my other social media as well as the backup channels, and let's get into the content. All right. So, I don't know if you guys are aware, but recently the CDC put out some information saying that they're not satisfied with the response that they gave to the C19 pandemic. Now, what I find interesting as well as ironic about that is that there was many people out there criticizing and critiquing the response and some of the things that were done and some of the methods that were used during the C19 pandemic. But if you were not a part of the mainstream media, if you were not a part of a government organization, if you verbalized your critiques of some of these things that we thought were not in the best interest of the public, the content would get removed. YouTube would remove the content. Facebook would remove the content. Instagram, everybody would remove the content. Twitter, especially. Now, CDC is, as its own governing body, is coming out saying we had a lot of failures, pitfalls, and shortcomings during the pandemic, and we apologize. We want to make things better. Okay, why, when other people were critiquing, were we not allowed to say that? We would get our videos removed. Shout out to my man Law. What's good with it, bro? So we'll get into that later, and we'll also start talking about these quote new vaccines, because they have new vaccines that are available that are specific for the BA4 and BA5 variants that are different than the vaccines that were available for the original variants of COVID. So I find that interesting as well. And I wonder what the strategy will be going forward with that. So before we get into all that, I don't know if you guys are subscribed to Blacklight Revelations 1 or Blacklight Revelations 2. If you guys are not, make sure that you guys are, because on those channels, I have community walls and I'm able to post articles of different things like this. This is an article here from the Daily Signal, and it says, as DC plans to ban 40% of black teens from school, mayor rejects DC COVID vaccine numbers. What do you guys think about that? During a Monday press conference, D.C. Mayor Muriel Bowser seemingly claimed her department's own numbers surrounding the amount of black school-age children vaccinated against COVID-19 were inaccurate. Unvaccinated school children will be banned from attending Washington, D.C. public schools later this month. So basically what this article is this is a emotional grab that the conservatives are trying to use by putting the word black in it, and then trying to get you to pay attention to this article from their perspective. You need to pay attention to this article from your own perspective. The most important thing that they said here is, during a Monday press conference, DC Mayor Bowser seemingly claimed her department's numbers surrounding the amount of black school-age children vaccinated against COVID-19 were inaccurate. That's what's important. It's not important the point that the Daily Signal is trying to make, because they don't have a point. Okay. But this is what's important for us, is that they're not keeping track of these numbers. So now my question is, what other numbers aren't kept track of properly? We've been saying for a long time that the census was undercounted, but I guess because some conservatives want to get some black people involved in their C19 outrage, we're supposed to pay attention to the fact that in DC, the numbers are inaccurate. There's all kinds of numbers that are inaccurate. The crime rate, unemployment rate, the value of the dollar. I mean, are we going to start doing an inventory of all inaccurate American numbers? I'll tell you some numbers that are accurate. The amount of white males who have monkeypox, that's a number that's accurate. You know what I'm saying? So now here it says unvaccinated school children will be banned from attending Washington, D.C. public schools later this month. So what they're doing here is they're trying to make it as if, hey, look at this black lady. She's banning all these black kids. Look at her. Look at her. It's a Democratic town. The same shit that they always do. What you need to pay attention to is that they're not keeping track of the numbers. It doesn't matter about being Democrat. It doesn't matter about being Republican. You know what I'm saying? What matters is that the government's not doing their job, which they never do anyway, despite the fact that they get that nice pension and they get paid so damn much. Shout out to my man AJ. What up with it, bro? So now here it says unvaccinated school children will be banned from attending Washington, D.C. public schools later this month. So now the reason why they put black in the title is because they're specifically trying to get you outraged about that population of black kids who's not vaccinated that may not be able to go to school. Okay. That's what that is. All right. So now here it says, in response to a question from the Daily Signal about how 40% of black school-age children were unvaccinated, Bowser responded, I don't think that number is correct. We have a substantially fewer number of kids that we have to engage with vaccination. Now, here's my question. How do you all feel about that? Let's check this out. It says, this is from some journalist named Douglas Blair, or some wannabe journalist. I asked DC Mayor Bowser how she could justify forcing 40% of unvaccinated black students to stay home from school. She said my numbers are wrong. They're her numbers. Now, here's my question, and I'm going to do to him the same thing that they do. What about all the other kids that are unvaccinated? Shout out to Val. The fake Mayo outrage is comical at best.
A few questions. Yes.
My name is Doug Blair with the Daily Signal, and the question I have is that we have reporting that around 40% of black students in the district are unvaccinated.
Anytime there's a white person acting as if they're concerned about anything other than reparations, red flag. If you're not asking about reparations, red flag. There's no genuine concern here about the black kids because this dude is a right-wing conservative that thinks black people have a low IQ of 68 maximum anyway. So why is this white dude outraged about these C19 numbers? You have to ask yourself these questions. And you see, Muriel Bowser is a Democratic puppet, so she's definitely not going to respond in the way that I would. So there's that. Like I said, anytime you see white people showing over concern about what's going on with black people, it's a red flag. It's opportunism. It's not because of genuine actually wanting to advance or improve as a human race. It's to prove a point, to get you emotionally involved, to either help them with their battle against their enemies or something like that. Because, I mean, he's not going to do anything about those black kids. This is one of the same people that was outraged that in places like Montana, they said, we're going to vaccinate people of color first. Oh, my God. Well, okay, down here in D.C., if there's 40% of black kids that aren't vaccinated, then clearly, quote, since they want to call us people of color, those kids of color need to be vaccinated, right? So how does that work? You're outraged here, but now you're asking questions as if you're genuinely concerned. There's no concern. It's just nonsense. It's just political games.
A few questions. Yes.
My name is Doug Blair with the Daily Signal, and the question I have is that we have reporting that around 40% of black students in the district are unvaccinated, and therefore, under the district's current policy regarding schools, will be unable to attend school come the school semester starting. So why is the district continuing with this policy when it seems to disproportionately impact black students?
You see how he can so easily talk about something disproportionately affecting black students? Okay, let's talk about that wealth gap. Let's talk about how wealth and property disproportionately are in the hands of white people. Can we talk about those disproportions? Can we talk about those disproportions? But they have this black puppet up here, Muriel Bowser, who, I mean, you know, I calculated the numbers myself and they all wrong.
I don't think that number is correct. We have a substantially fewer number of kids that we have to engage with vaccination. And I explained why it's important. It's important for the public health of our students and that we can maintain safe environments.
Now that's interesting, because I guarantee you that white dude would then respond and say, well, the black kids that go to those schools are the ones that commit most of the crimes. So if that 40% of black kids stays out of the schools, wouldn't that contribute to a safe environment? Now that's what he'll go and turn around and tell Fox News, and that's what they'll be talking about at their dinner tables. So just pay very close attention. When it comes to this, when it comes to anything, the only thing that matters is the information that we collect ourselves, because nothing that they collect is legitimate. No information that they bring forth is of sound mind or sound purpose. So now here it says, while Bowser claimed the number provided by the Daily Signal is incorrect, the statistic came from the District of Columbia's own vaccination data website. The data shows that around 60% of Black kids aged 12 through 17 have received a complete COVID-19 vaccine regimen, meaning that 40% are unvaccinated or have not received a second shot if necessary. The number flips for Blacks aged 18 through 24, as the DC data shows 60% of adults in that age bracket are unvaccinated or have not received their second shot if necessary. So now here's my question. How do you all feel about these vaccines and what's going on in the DC area? What do you guys think about this? And real quick, ladies and gentlemen, if you guys haven't smashed that like button, we got 6 people watching. Shout out and thank you to all 6 people who are watching. If everybody can take a moment and smash that like button, we'll be at 8 likes. So please make sure you guys smash that like button. And if you agree with my man Emmanuel Carey, give me a thumbs up. I think most people do, but let's just get the consensus on it. If you guys agree, give me a thumbs up. Now, my question for that white dude is why he's not concerned about the white kids. And my question is, why does he think that Black kids don't have a vaccine in comparison to white kids? Let's get to the bottom of these questions that this silly white boy is asking. Because that's the only reason why he's asking these questions, is because he's a silly white boy playing silly white journalistic games. You want to get to the root of the problems, then let's get to the root of the problems. Let's start talking about that racial wealth gap, because the racial wealth gap is the root of all problems. So now here it says, per DC's Office of the State Superintendent of Education website, beginning in the 2022-2023 school year, the COVID-19 vaccine is required for school enrollment and attendance in the District of Columbia for all students who are of an age where there is a COVID-19 vaccination fully approved by the U.S. Food and Drug Administration. As of right now, that means DC students aged 12 and up will have to be vaccinated or they will be unable to attend school in person. Now, this is my question for you guys. How do you all feel about that? What do you guys think about that particular rule? That's my question. What do you guys think about that? We're going to take a break from that because remember, that's based on CDC recommendations, right? And what I want to show you is, I want to show you what's been going on with the CDC lately, okay? The CDC, they've gone back on their word. So let's take a look at this. And if you guys watched Just Talking with TD and Rob yesterday, we briefly went into this. We're going to go over this extensively here.
The CDC will be going through a reorganization following criticism over the agency's handling of the COVID-19 pandemic and other public health threats. CBS News chief medical correspondent Dr. John LaPook is here with me, and he spoke exclusively with CDC Director Dr. Rochelle Walensky about the changes.
Today's report uncovered deep concerns over the CDC's culture and day-to-day practices. Among the complaints, a rigid, compartmentalized bureaucracy that restricted the agency's overall response to the pandemic, from its analysis of data to the sluggish release of information to the public to its confusing and overwhelming COVID guidance. Was the agency up to the task of handling this pandemic?
I think our public health infrastructure in the country was not up to the task of handling this pandemic.
CDC Director Dr. Rochelle Walensky commissioned the report in April.
We learned some hard lessons over the last 3.
Real quick, ladies and gentlemen, shout out to Roots Tracker over there on Facebook. If you want to come on YouTube, you can. There's more people in the chat. All you got to do is just find Black Light Revelations C19 Report, and you'll be right over here, because I don't think there's many people over there in that Facebook chat. So just so you know.
Years, and as part of that, it's my responsibility, it's the agency's responsibility to learn from those lessons and do better.
The new findings are likely to spark a major shakeup of the CDC's sprawling bureaucracy. Among the plans, get information to the public more rapidly, create a new office to promote equity in healthcare, and develop a more nimble workforce that can quickly respond to public health crises.
All right, so now right here, right, create a new office to promote equity in healthcare. That's already failing, right? That's already failing based on the report from the DC area, right? Shout out to Tammy. What up with it, Tammy? My man Emmanuel says because the white kids are fine and because black kids' parents obviously don't know where to get the vax because we can't access the internet. Now, here's my thing. I mean, I'm sure they got cell phones. They can access the internet. You know what I'm saying? And if it's that bad, if it's that bad to the point that they can't access the internet, more than likely they're getting some kind of government aid wherever it is that they sign up or get their information from in the mail. They send those brochures and foldouts in everything. Me personally, I just think that there's a lot of black people who say, nah, I remember Tuskegee. It's not going down like that. And I really don't want people shooting up shit in my kids. I think that's what the sentiment is. You know what I'm saying? Yeah, that's what Joe said. We're too stupid. Yeah, I agree with that. Facts. Not just Joe. You know what I'm saying? Most of America. White, non-white people. You know what I'm saying? Shout out to my man, Al McCowan. That's one of the reasons why I'm an intelligence advocate. Because when the world continues to try to place a stigma upon you as if you're stupid, the best way to deal with that stigma is to become the smartest group of people on the planet and bully everybody around with your brains and show no mercy while you're doing it so that they remember to never try to do that nonsense again.
We need to have a special forces, if you will, to deploy during pandemic times.
Do you think they're up to the task of now changing their whole culture and thinking of themselves more like special forces that can be deployed wherever they're needed?
I have no doubt that they're up to the task.
The report comes with a new sense of urgency as the CDC moves from managing the pandemic to dealing with the latest public health crisis, monkeypox. Is it fair to say we're not quite there yet in terms of monkeypox?
I think it's too early to say
What happened here?
that we have
we
our
go.
arms around it. I believe that we can work to contain this outbreak, and we're doing a lot of that hard work.
Dr. Walensky told me the CDC has to up its game when it comes to making the agency's workforce more nimble, improving capabilities in the lab, and becoming better at gathering and reporting data. And Lana, because we don't know what the next public health challenge would be, we gotta get ready right now.
Yeah, we
do know what the next public health challenge is. The current public health challenge is monkeypox, and the CDC is failing with that also. And we predicted a failure because of the way that it was being handled early on. None of those things that they listed, in my opinion, are anything that's going to help the CDC with handling things better, in my opinion. This stuff right here. Get information to the public more rapidly. How about get accurate information? And then once you've gathered accurate information, get that to the public more carefully. Because in my opinion, one of the problems that we were having with all of these situations is that information was changing too quickly because they were putting out just anything instead of actually peer reviewing everything that came out and then actually putting out actual factual information. That's why I encourage everybody, even though a lot of the articles, have since passed and, we're dealing with new diseases and different things like that, still check out these videos from the C19 report as they come up on your timeline, even if they're old, because you'll see the difference from the things that we said here versus the difference of what went on and how they dealt with it. And you will see now they're going back. And just imagine those critiques that weren't removed from YouTube, because a lot of videos got struck down. People like Ulaw that have been around and watching this channel for a long time since it first started. I used to do a response video to every time one of my videos got removed. So even as you watch the old videos, you will see the responses to the response of me getting a video removed. And now a lot of the things that I got videos removed for, that's what the CDC is saying. One of the reasons why the response failed so bad was because there was no independent thought. They weren't allowing people to properly critique this. Just trying to say automatically, oh, well, you're not a doctor, you're not this, you're not that, so you don't know, you can't critique it. Like, are you serious? Real quick, ladies and gentlemen, shout out and thank you to all 9 people that are watching. If everybody smashes that like button, we'll have 18 likes. Remember, guys, we got that goal of 100, so let's try to get there. Val says there are disparities in healthcare, but a lot of Black parents don't trust the doctors. Now, here's my question. Should they? Riza Islam is always saying don't trust those, the V's. CDC appears incompetent. They're doing an entire reconstruction of the CDC. What does that tell you about their competency? Let me know in the comment section what that tells you.
Among the plans, get information to the public more rapidly, create a new office to promote equity in healthcare, and develop a more nimble workforce that can quickly respond to public health crises.
We need to have a special forces, if you will, to deploy during pandemic times.
Do you think they're up to the task of now changing their whole culture and thinking of themselves more like special forces that can be deployed wherever they're needed?
I have no doubt that they're up to the task.
The report comes with a new sense of urgency as the CDC moves from managing the pandemic to dealing with the latest public health crisis, monkeypox.
Is it fair to say we're not quite there yet in terms of monkeypox?
I think it's too early to say that we have our arms around it. I believe that we can work to contain this outbreak, and we're doing a lot of that hard work.
Dr. Walensky told me the CDC has to up its game when it comes to making the agency's workforce more nimble, improving capabilities in the lab, and becoming better at gathering and reporting data. And Lana, because we don't know what the next public health challenge would be, we gotta get ready right now.
Yeah, we know it's coming. We don't know what it is, but we know that it's coming. Sure. I have to just start off with
we know a lot of things that are on the horizon. So this is the question: how, if you're in the media, do you not know what it's gonna be? There's that virus that's coming out of China. I can't think of the name of it. There's polio that they just found in New York. There's monkeypox. And then there's the things that we already deal with. Bad medication from Big Pharma, diabetes, heart disease. I mean, if you guys know any public health emergencies that we can think of, type them into the comments. There's plenty. Shout out to my man, Mike Mellis-John.
The special forces idea. Can you tell me more about that?
This was something that I had never even thought of, but I've been covering the pandemic since the very beginning. Dr. Walensky said about 20% of the 13,000 people who work for the CDC have been deployed.
Shout out to Carla. Pandemic. What up with it, Carla?
Now, I just thought, okay, they're working on the pandemic, but actually they were only there for months, a couple of months or maybe 6 months. And sometimes they don't leave and they sort of say, look, we're staying where we are. It's part of the culture that has to change to say, look, I know you joined the CDC and you're interested in this, but if there's an emergency, you may have to shift gears and deploy like special forces. You have to be trained and ready to go from this problem to that problem. Yes, you're dealing today with COVID, but you may be switched to monkeypox. This was an organization that started 76 years ago to fight malaria, and a lot has changed since then.
So much has changed. And you and I were speaking before this segment about some of the challenges that the CDC has chronically faced in terms of funding and also now increased division, it seems like, in the country's perception of the CDC.
Absolutely. Well, I remember I did
Shout
a
out to my man, Black Manta.
for
what up with it, bro?
Anthony Fauci, Dr. Fauci, and we showed him walking along the river with his wife. He needed armed guards.
Now, here's my question. What is you all's thoughts on how the pandemic response for C19 and the responses for monkeypox have been? Let me know what you guys think. Do you all feel that these have been covered in a way that reflects the amount of tax dollars that they receive from us? Let me know.
Be with him. I mean, I spoke to Dr. Michelle Williams, who's the head of public health for the T.H. Chan School of Public Health at Harvard, and she has a special button, a panic button, in her office. So we've never had this before. So this is a public health system that not only has been underfunded for many, many decades, but then we have the public pushing back on it right now.
So they say that it's been underfunded. Now, here's my question. Exactly how much money do they expect? How much money do they expect? It's been underfunded? How much money for the public health system do they expect? They get billions of dollars in tax money every year for the public health system. How much do they expect?
Yeah. So given these roadblocks, how optimistic was Dr. Walensky about, and how optimistic are you about the ability of the CDC to make these changes?
I think there are huge challenges ahead. I think one of the things that has to happen is better handling of data. So I did a Sunday morning piece on the public health system just a few weeks ago. And in the middle of the pandemic, right at the very beginning, there were orders coming from doctors' offices
Facts.
for COVID testing via fax. I mean, I saw the fax machine. We have data systems, all kinds of different ones across the country, even though we've had the ability for decades to securely communicate with each other. There's no secure handshaking for many of them. It's just a mishmash of different systems. So the CDC has been criticized saying, how come you don't have the data? Well, they actually usually don't have the power to demand that these places send them data. During special emergencies like COVID, they can say, yes, you're empowered. You need to send us data. But
that's not true. Because the president can write an executive order, and they can also write an executive order through FEMA to get that information. Now, if they tried doing that, if they did that, there would be a lot of public backlash. A lot of people would be very upset with that. They could probably also do it through the Patriot Act as well. Shout out to my man Kareem Yee. So that's not accurate what this guy is saying here, which is one of the reasons why, in my opinion, it's one thing that people need to stop doing is stop looking to the white media as a validating source of information. Stop doing that. And I'm not saying stop doing that to you guys. I'm saying that that's what people need to stop doing. I know you guys don't do that. People need to start making a habit of looking at black media first and then comparing it to the white media. Not looking at the white media for the validating information. Because as far as I'm concerned, if the world watched Blacklight Revelation's C19 report, monkeypox and C19 would have been handled a lot better. And I'm saying that with confidence. I still got all my videos up. I gave my recommendations on what I thought should be done and how things should be done. They're still up for people to look at. The things that you heard on this channel were far different than what the mainstream media was talking about. But now as we go in full circle, the mainstream media is as much money as they're making, and all of the people that they have access to, they're saying a lot of the same things that I said way in the beginning to a larger audience, as if it was them that, created everything. What up with it, Roots Tracker? Welcome, welcome. Yeah, I have that 5-minute lock thing on all the chats to try to keep trolls out, but there's some trolls that are really invested that really want to they really want to be a part of attempting to disrupt the chat, which they never do successfully. They just end up getting, intellectually roasted. Shout out to Maya. What up with it, Maya? It's almost like they're throwing spaghetti at the wall and hoping something sticks. They shouldn't waste that good spaghetti. You know what I'm saying? Especially if they got some good marinara on it and some really good seasoned turkey meatballs. They better not be throwing spaghetti around like that. That's sacrilege.
Even when they're empowered to do so, there's often not the data structures and the computers and the wires, the roadways to be able to make that efficient. So they've got huge challenges. I do think Dr. Walensky is very serious. To me, she's very impressive in the way she's approaching this, and I have to hand it to her. I said
shout out to Donna. What up with it, Donna? And just real quick, just so everybody's aware, the reason why I encourage everybody to go and make sure that they subscribe to my Facebook and my Twitter, my other social medias that I have listed, is because for one, they give another notification. And for two, if you chat there, I can see you in the chat. And if you can't find the channel on YouTube that I'm broadcasting from, I could just tell you, just like how I did Roots Tracker, because I know that YouTube doesn't provide adequate notifications all the time. And also, if I end up losing a channel or something like that, I still have those other social medias where everybody's together, so that's the reason why I tell everybody, make sure that you're subscribed to the backup channels and all that other stuff. You know what I'm saying? Because that helps, you know.
Given everything that's happened with COVID, and then there's monkeypox, and now there's polio, why did you commission this report in the first place? And she said, look, we have to be honest about this. I wanted to do the job, and whatever the advice is, that's something we have to take very seriously.
So now we'll be getting more into the critique of the response from the CDC, but we're going to get back into this DC schools article. Okay. We're going to get back into this DC schools article from the Daily Signal. So now here it says the vaccine requirement makes DC an outlier in the nation, as many of the larger school districts recommend but do not require a COVID-19 vaccine in order to attend school in person. The Daily Signal then asked the mayor about whether or not it was appropriate to respond to kids who aren't vaccinated by forcing them to attend to school virtually. She says, "You've never heard me say that." Bowser and the D.C. city government have clashed over whether or not to return kids to classrooms amid lingering COVID-19 concerns. While Bowser has gone on record stating she would prefer kids to be in school, the 13-member D.C. Council has pushed for more exceptions to allow for remote learning. The Daily Signal reached out to Bowers' office for comment on the numbers and to clarify her position on remote learning, but did not receive an immediate response. All right. So now we all know what this is. And basically what it is just the Democrats trying to boost those numbers. They're trying to boost those vax numbers. But now we got to ask the question, which vax? Because there's new vaxes coming out. How many people were aware the new vaxes coming out? If you guys were aware, give me a thumbs up. If you guys aren't aware, give me a thumbs down. Walensky citing botched pandemic response, calls for CDC organization. Botched pandemic response. Botched so badly that they're reorganizing the entire CDC. What do you guys think about that? That's pretty bad. That's pretty bad. They're going to reorganize the entire CDC because of the pandemic response. Now, here's my question, and this is a very easy question to answer. What does that say about the pandemic response? What does that say about the pandemic response? Among other flaws, public guidance during the coronavirus was confusing and overwhelming, the agency said. Now, when there was YouTube content creators and people posting things about that on Twitter, it was removed. Channels were struck. But it's okay for the CDC to say this about itself, but it's not okay for outside independent entities to make these same comments and have them distributed publicly. My question for you guys is why? Donna says she was watching Kim Iverson's channel covering Dr. Lena Wen and her reaction to the lockdowns enforcing vaccines. Yeah, Kim Iverson has been on it as far as, her stance on C19 as one of the reasons why she ended up leaving the Hill. You know what I'm saying? So now here, this is what Dr. Walensky says, which I find fascinating because now we got Dr. Walensky. And where's Dr. Fauci been? What is Dr. Fauci's thoughts on the reorganization of the CDC? My goal is a new public health action-oriented culture at the CDC that emphasizes accountability, collaboration, communication, and timelines. Dr. Rochelle P. Walensky, the agency's director, said in a statement on Wednesday. So now I don't know if you guys were aware of Operation Dark Winter. I've talked about it before. I've done several videos on it. There's a video on it on this channel. They did an exercise a while ago that was measuring pandemic response. That exercise showed that the United States wasn't really in the position to deal with a major pandemic. My question for everybody is, what did the United States do with that data, and why hasn't there been any viable improvement? And I think that those are reasonable questions to ask. Those would be reasonable questions to ask, wouldn't they? So now here it says Dr. Rochelle P. Walensky, the director of the Centers for Disease Control and Prevention, on Wednesday delivered a sweeping rebuke of her agency's handling of the coronavirus pandemic. So Dr. Rochelle P. Walensky, who's the director of the Center for Disease Control and Prevention, on Wednesday delivered a sweeping rebuke of her agency's handling of the coronavirus pandemic, saying it had failed to respond quickly enough and needed to be overhauled. You think? You think? The United States Centers for Disease Control should have been responding to this as soon as the information about this came out in China. Anytime they just hear about a disease that's spreading quickly, even if there's no cases in the United States, a response needs to be initiated. If you ask me, in my opinion. If you guys agree with that, give me a thumbs up. If you guys disagree, give me a thumbs down. Because when a threat like that is identified, prevention and a barrier to entry needs to begin to be established. But when you just sit around and watch, though, we just gonna watch it. We just gonna watch it. Okay, you just gonna watch it. Well, guess what? Now you're watching a pandemic unfold. So now here it says Dr. Walensky said the CDC's future depended on whether it could absorb the lessons of the last few years, during which much of the public lost trust in the agency's ability to handle a pandemic that has killed more than 1 million Americans. This is our watershed moment. We must pivot, she said. Her admission of the agency's failings, look at this, her admission of the agency's failings came after she received the findings of an examination she ordered in April amid scathing criticism of the CDC's performance. The report itself was not released, and agency officials said it was not yet finished, but would be made public soon. So that must mean that we were on to something. Those of us who were critical of the way that the United States was responding, we were onto something, and they wouldn't allow those messages to be put out. But now this content where Dr. Walensky herself is the one doing the critique, we're allowed to just talk about it. As long as she said it, it's okay. How does that work? Make that make some sense. The report itself was not released, so we still don't know what was in this report. Dr. Walensky laid out her basic conclusion from the review in candid terms. The CDC must refocus itself on public health needs, respond much faster to emergencies and outbreaks of disease, and provide information in a way that ordinary people and state and local health authorities can understand and put to use. What do you guys think about that? Shout out to my man, AB Promotions. What up with it, bro? So now here it says, in an interview on Monday, Dr. Walensky stressed that hundreds of Americans were still dying each day from the coronavirus, and that while the country has not yet seen deaths from the outbreak of the new disease, monkeypox, it has presented some of the same kind of challenges for the agency. The CDC has been criticized for years as being too academic and insular. The coronavirus pandemic brought those failings into public view. Even with some of the agency's staunchest defenders criticizing its response as inept. It remains unclear whether Dr. Walensky, an infectious disease expert whom President Biden picked to lead the agency in December of 2020, can bring about the changes many see as necessary. Here's my question: after her admission of the botched pandemic, after her admission of the botched pandemic response, why is she still employed? Why does she still have a job? Why does she have the option and the ability to fix it when she was the one that's responsible for this agency and its response in the first place? Does that make any sense? If that makes any sense, give me a thumbs up. If it doesn't, give me a thumbs down. In my opinion, she should be up out of there. They need to Liz Cheney her. And real quick, ladies and gentlemen, we got 15 live viewers. Shout out to all 15 people watching, and we got 17 likes. If everybody can take a moment and smash that like button, we'll be at 32 likes, which would be great. Remember, we need 100 likes per stream, 100 likes per video, so help your boy out with that. Can she do it? I don't know. Does it absolutely need to be done? Yes. It is just a reorganization. Is it just a reorganization that's required? No. Jennifer Nuzzo, an epidemiologist and director of the Pandemic Center at Brown University School of Public Health, said. That means that she feels that more needs to be done than just a reorganization. She feels that more needs to be done than a reorganization. I got to agree with that. Here's my question for you guys, and I need you guys to answer this question in the comment section. What do you feel the CDC could have done different to slow or even prevent the spread of COVID? Others said it was difficult to judge Dr. Walensky's moves without more information, including the report she commissioned. The review was led by James McCrae, who has held senior positions at the Department of Health and Human Services, which oversees the CDC. He interviewed about 120 people inside and outside of the agency. Just saying we're strengthening this and that. The devil is in the details there. Dr. Howard Markle, a professor of the history of medicine at the University of Michigan, who has advised the CDC, says. The agency has been under fire since the outset of the coronavirus pandemic 2.5 years ago. See? Everybody was criticizing the way that the CDC handled it. And the reason why everybody was criticizing the way that the CDC handled it was because they didn't handle it. It's still not handled. I mean, look at the article that we just read about what's going on in Washington, D.C. It bent to political pressure from the Trump White House to alter key public health guidance or withhold it from the public. Decisions that cost it a measure of public trust that experts say it still has not recaptured. Now, okay, so my question is, what was it that Trump did that made them not give any information to the public? It says it bends to political pressure from the Trump White House to alter key public health guidance. So that right there, when they're talking about the mandates, I believe. But they're using generalized terms to make it as if, there was this dictatorship going on. And then it says, or withhold it from the public. Now, I don't recall Trump wanting anything withheld from the public. Do you guys recall? Was there anything that Trump told them not to provide the public? I don't recall that. Maybe I'm wrong, but I don't recall that. It also made its own serious errors. Look at this. Look at this. It also made its own serious errors, including deploying a faulty COVID-19 test that set back the nation's efforts to curtail the spread of the virus. Now, wait a minute. When people were questioning the testing, when people were asking about the testing, YouTube, Facebook, Twitter, Instagram, and TikTok were all removing content that questioned the efficacy and accuracy of the testing. I can tell you this because I got videos removed and my TikTok account was completely deleted. Now, if you said that those tests had issues last year or a few months ago, your channel would get struck and your video would be removed. No one ever admitted to those tests being inaccurate until now. We're just going to talk about it in a matter-of-fact way. It also made its own serious errors, including deploying a faulty C19 test that set the nation's efforts to curtail the spread of the virus. While it has studied itself since Dr. Walensky assumed control about 18 months ago, the CDC has continued to fall short. Now, isn't it fascinating that the New York Times is allowed to put out an article like this? Because I'm telling you guys, just months ago, you were not allowed to critique any of this. You weren't even allowed to ask questions. I did a reaction video to a Rand Paul Senate hearing with Dr. Fauci, and it was removed. So now here it says its public guidance has often been confusing, even to public health experts. Leaders of its COVID-19 team rotate so frequently that other senior federal health officials have at times been unsure about who is in charge. So there's leadership issues. Now, they're not telling you any of this while this crisis is going on. They're telling you this after 1 million people have died here in the United States. Just so everybody's clear on that. Just so we're all clear on that. They're not telling you this while the crisis is going on. They're telling you this after 1 million casualties. And again, we don't even know how accurate this information is. This is simply information from the New York Times, which means what exactly? And important data was sometimes released too late to inform federal decisions, including studies on breakthrough infections that could have influenced the federal recommendation on authorizing a round of booster shots. I remember them. Now, they're calling these breakthrough infections, but I remember them removing videos when people were saying people with the vaccine are still getting infected. Yep. See, Val remembers. I did the Rand Paul video review and then YouTube removed it. Also, I did a review of a video from Project Veritas and they removed it. But now it's okay to talk about this. And YouTube should reinstate my videos. But they're not gonna. The CDC is gonna be the hero. Well, we messed up and we're gonna fix it. You messed up while there was people out there criticizing you, and because they have the power and they have the infrastructure, they can just remove content and make it as if it's not there. Well, nobody was concerned about this. Yeah, people were concerned about it. Go check out my videos on breakthrough infections. How many people know what a breakthrough infection is? That's one of the things that set the Omicron variant apart from the other variants, was that the Omicron, the very first Omicrons, BA1 and 2, one thing that they noticed was that they were causing breakthrough infections at a higher rate than the other ones. So now here it says, regardless of who led the agency, an honest and unbiased read of our recent history will yield the same conclusion. Dr. Walensky told employees, it's time for the CDC to change. But notice how she didn't step down. She outlined in broad terms how she hopes to transform operations by emphasizing public health needs, especially with the quicker response to emergencies like infectious disease outbreaks. One of her top priorities is to deliver clear, concise messages about public health threats in plain language that can be grasped without sifting through voluminous pages on a website. How about allowing content creators and independent news media to deliver information to the people that trust them? How about that? Instead of trying to regulate it. Because one thing that they did, if you ask me, and I want to see what you guys think about this, they did a better job of regulating information during COVID-19 than they did regulating COVID-19, which in my opinion is pathetic. And that's one of the reasons why the response did as horrible as it did, because they were more concerned about public perception than public health, which is the whole point of the CDC. They did a great job regulating information. Bad job regulating the pathogen that killed 1 million people. Too bad the information wasn't killing anybody. We have a whole bunch of survivors if that was the case, because that's what they spent most of their time and resources doing. Somebody said this, got to get rid of them. Somebody said that, got to get rid of them. Somebody said this, got to get rid of them. Meanwhile, people dropping dead from COVID. Not getting rid of COVID, though. So that's one way that the CDC can improve. Mind your own fucking business. You worry about the disease. Do your damn job. You're a center for disease control, not a center for information rerouting and regulation. So now here it says she outlined in broad terms how she hopes to transform operations by emphasizing public needs, especially with a quicker response to emergencies like infectious disease outbreaks. One of her top priorities is to deliver clear, concise messages about public health threats in plain language that can be grasped without sifting through voluminous pages on a website. Now, what I find problematic about this is that it didn't say anything about accurate information. Accurate information is what should be the priority. But as you guys can see, it's not. So now here it says, I think for a long time, the CDC has undervalued the importance of direct communication to the public with information the public can use, said Dr. Richard E. Besser, who served as an acting director of the agency during the Obama administration. Dr. David Dowdy, an epidemiologist at Johns Hopkins Bloomberg School of Public Health, said messages to the general public need to be very clear, very simple, very straightforward, not framed for scientists. I do think that culture is changing, but we need to change faster, he said. And not trying to be funny, but that's because the majority of public are idiots. But at the same time, clarity, simplicity, and straightforwardness don't matter if the information is incorrect. What matters is if the information is correct. Because regardless of whether the information is correct or not, the world is correct. So whatever C19 is capable of doing, it doesn't matter what kind of information you get somebody, is going to do what it's going to do. So they need to have accurate information of what it's going to do. One of the things that it's going to do is it can cause breakthrough infections. So removing a bunch of people's videos about breakthrough infections didn't do shit, because the world is correct. COVID can break through a vaccine, and it did, and it still is. You know what I'm saying? So trying to control information and trying to control public perception, because you see what it was about, what this whole thing was about was we can't have the public not have faith in the CDC. What we have to have is we have to have the public assuming that we have everything under control, because if we don't have everything under control, then the public's going to start losing faith, and then everything's really going to be out of control. So the priority that the CDC had was to maintain an image of public control. But people aren't stupid. Why they keep saying that you need to have things concise and simple? One thing that we simply understood was that they had no control over C19, and they still don't. C19 is mutating whenever it wants to, any way it wants to, changing the spike proteins at will, and nobody's doing a damn thing about it because they can't. The only thing that we can do is try to prevent it from happening, prevent people from getting infected, give people the accurate information on ways to stop the transmission of it, not just force people to do something. See, if I force people to do something, that shows that I have control over people. I'm going to force you to get this medication. I'm going to force you to put this over your face. Okay. All that does is shows that you can get people to abide by your rules. What you need to have abiding by your rules is the virus. But you're not regulating the virus because you can't. But if we show control, there's a public perception of something's being done. If I look around and everybody got these masks and paper bags over their head, okay, something's being done. What's being done? What's being done is that the public is being told to do this. The public is being told to do that. The public is being told to do this. The public is being told to do that. And meanwhile, while all that's going on, C19 is reconfiguring itself at will like a damn Rubik's Cube. Now I'm going to change this spike protein. Now I'm going to change that spike protein. Now I'm going to change this surface glycoprotein. I'm going to change that one. Oh, you got a vaccine? Okay, well, I'll just change myself into a different variant. What's supposed to be controlled is the disease, the Center for Disease Control, not the Center for Public Control, the Center for Disease Control. Are we controlling any diseases? If we were controlling any diseases, then that means that the transmission of those diseases would be going in the direction that we want, which is we want the number of those transmissions to decrease. Has the number of transmissions went the direction that we've desired it to since any onset of any pandemic in the most recent time period? No, it hasn't. Which means that the Center for Disease Control is controlling people. It's making people do things. It's not doing anything to stop the movement of the disease. It's stopping or affecting or changing the movement of people. People can't move in and out of a store at 9 p.m. because the stores are closed as a result of C19 regulations. C19 can move in and out of your lungs 24/7. You're not controlling the disease because the disease still has free will to do whatever it wants. The name of the organization is the Center for Disease Control and Prevention. What is the Center for Disease Control and Prevention controlling or preventing? It's controlling people and it's preventing logistics. What is it controlling and preventing in regards to COVID-19? It's not preventing any mutations. It hasn't eradicated the spread. So now we have to test the efficacy of this organization. And people find this maybe disturbing, but it doesn't matter. Humanity cannot control nature. Humanity can only work within nature, which means that you'll never be able to control a virus. You'll only be able to control how humans deal with it. And they did a bad job of instructing people how to deal with it. The name Disease Control and Prevention is a grandiose automatic failure to begin with. You're not controlling any disease. You didn't control COVID-19 from jumping from bats to human. You didn't control anything. You're not preventing anything either. And that's the problem. In my opinion, it's up to people to control and prevent issues that we have, because while the government is sitting there saying that we're stupid, the government shows how stupid it is every single time it's put to the task of having to do something challenging. The COVID-19 pandemic was a challenge. The government failed. Russia invading Ukraine was a challenge. The government failed. Racism here in the United States is a challenge. The government failed. The government will always fail. Even if you read a macroeconomics book, they'll always tell you that the government is more inefficient than anything privatized. It'll always fail. That's just a fact of life. It'll fail worse when you have incompetent staff, and it'll fail worse when the actual agenda is to not actually deal with the problem that we're addressing. Here's my question. What do you all think will result from this quote unquote CDC overhaul? Do you think that anything will improve? Do you think that they will actually make the necessary changes to be better equipped to deal with the next pandemic? What do you all think is going to happen? That's my question. Real quick, ladies and gentlemen, shout out to all 20 people watching. We got 20 live viewers and we got 20 likes. If everybody can take a moment and smash that like button and get us up to 40, that'd be awesome. So now here it says other plan changes are more bureaucratic, but could have a big impact. A new executive team will be created to set priorities and make decisions on how to spend the agency's annual $12 billion budget with a bias towards public health impact, according to a media briefing document. The agency receives $12 billion annually, but they say that that's underfunded. So I'm curious as to what they feel their budget needs to be. Do you all think that $12 billion annually is enough for the Center for Disease Control and Prevention to adequately do its job? Two scientific divisions will now report directly to Dr. Walensky's office, a move that appears to be aimed at speeding up delivery of data. And again, delivery of data is important, but it's not the most important thing. Accuracy of data, in my opinion, is the most important thing, not speed. Shout out to my man DJ Elmo. What up with it? Which would you all prioritize, accuracy or speed? If you can get them both at the same time, I'd say get them both. But if we're able to prioritize, I'd say accuracy is more important, with speed being right next to it. But they have to work in combination as well, though. You have to have speed and accuracy. If you have speed with bad information, you're going to get people confused really quick, which, I mean, that's kind of what we saw, isn't it? Mary Wakefield, a former deputy health secretary in the Obama administration, was appointed to lead the reforms. Dr. Walensky hopes to cut down the review time for urgently needed studies, emphasizing production of data for action as opposed to data for publication, the briefing document said. In an interview, Dr. Walensky said that while some of the data are messy, some of the data take time. I've really tried hard to push data out when we need it. The agency aims to alter its promotion system so that it rewards employees' efforts to make an impact on public health and focuses less on the number of scientific papers published. That's not going to change anything overnight, but in the long run, it will have a huge impact, said Kyle McGowan, who serves as a chief of staff for the agency during the Trump administration and fiercely criticized the administration's interference in the CDC decision-making after he left the agency. Dr. Walensky also plans to create a stronger cadre of officials who respond to public health crisis by training more staff and requiring that those officials remain in their position for at least 6 months. Previously, officials in charge of the pandemic response often left after only a few months, a system that helped migrate burnout but also sowed confusion. So, I mean, here's my question. When it comes to organizations like the CDC, do they wait until something bad happens and then say, you know, we need to reorganize things? Now, here's my question, right? Many people thought that the CDC was a good organization. Many people thought that the CDC had it together. This is my question right here. Let's take a look at the U.S. military. If the CDC couldn't handle COVID, what if we went to war tomorrow? Would the military response, who is from the same government as the CDC, would it be just as bad, just as botched as the COVID response? What would come of it? That's my question. What do you guys think? Dr. Walensky stressed that she would not let the burden of responding to a public health threat fall on just a few people. This is an agency-wide top priority to respond when we are called upon, she said. We've had the same people who deploy over and over again, said Mr. McGowan. What they need is for more people to deploy longer. Many of the CDC's experts are accustomed to conducting narrowly focused research that undergoes lengthy reviews, and they are uneasy with the kind of urgent action needed to address public health threats. That type of research is still critical, many experts say. Having expertise in those rare diseases is very valuable, and it becomes valuable at the time you just don't really know, said Dr. Mitchell Wolf, who left the CDC in June after serving as its chief medical officer. I think that monkeypox is a great example. A year ago, people would have asked why you have a monkeypox expert, he said, and some of the CDC's problems are beyond its control. Much of its funding is tied to work on specific diseases and cannot be shifted to address the public health threats. The agency also lacks legal authority to compel state and local health departments to deliver public health data. The pandemic itself is another impediment. The agency's massive complex outside Atlanta sits mostly empty, while employees, including Dr. Walensky, work remotely. The actions that are being taken all strike me as actions that make sense and would make the CDC a more effective public health agency, said Dr. Besser, the former CDC acting director. But he said it was hard to see how Dr. Walensky could execute wholesale changes when she only sees most of her staff at a distance. I don't know how you motivate and inspire culture change when people aren't together, he said. What do you guys think? We have an admission from the CDC that the response was botched. How often does that happen? That's the question. Do you all think that any of these changes that the CDC is talking about making are going to improve things? Are we going to see a better response? Is there going to be a better COVID response? Is there going to be a better monkeypox response? That's the question. Or is this just talk? Now, here's my question. If the CDC is under such scrutiny and the methods that it used were ineffective, my question is, why are we still using those same methods? Does that make any sense? Why are we doing that? Still encouraging all of the same things that we encouraged before. Everyone over 12 is now expected to be eligible for the new boosters. This is what a White House official says. So we're still using the same strategies. So let's listen to what they're talking about here. See if we can make some sense of this. Which we probably won't be able to, because when it comes to these people, what makes any sense?
Beyond the upheaval at the CDC, we're getting a better sense of what the future may hold for combating COVID, with plans for a new booster to be offered soon. For more, I'm joined by Dr. Ashish Jha, the White House COVID response coordinator. Good to have you here. Doctor, before we talk about the updated vaccines, let me ask you about this admission by the head of the CDC that the agency missed the mark in its COVID response, especially when it came to communications. But is it just the CDC? In your opinion, has the whole of government failed on some levels here?
Yeah, so let's remind ourselves that Dr. Walensky, the director of the CDC, asked for this review of the CDC. I think that review was very well done. It laid out areas where the CDC needs to improve. And the bottom line is that she's committed to making those changes. And I think that's really important. To your broader question, our government agencies weren't designed to manage a once-in-a-century crisis like this.
Well, what were they there for then? And it's not a once-in-a-century crisis. Infectious disease happens all the time. Every hospital has an infectious disease department. There's infectious disease doctors called epidemiologists. What is this guy talking about? And why not? I mean, public health means that the public has health issues. So my question is, what the hell was the CDC set up for then? And shout out to Angela Wright. She says, you are on point. Thanks for talking about it. Keep up the great work. I appreciate it. Glad you enjoy.
Asked for this review of the CDC. I think that review was very well done. It laid out areas where the CDC needs to improve. And the bottom line is that she's committed to making those changes. And I think that's really important. To your broader question, our government agencies weren't designed to manage a once-in-a-century crisis like this. And I think while many of them performed admirably, there is no question in my mind that these agencies could have done better.
All right, if I can, let me turn to the vaccines now. We've been told that a dual strain version, if you will, covering older variants as well as Omicron, may be ready in just a few weeks. Who will be the first in line? Is this essentially going to be a third booster?
Yeah, Lester, here's why the FDA has pushed us to build these vaccines. And the bottom line is that this.
What I want you guys to pay attention to is how the doctor just doesn't answer his question at all. You notice that? The news reporter here, who's got a lot of makeup and look like he's ready to pose as a casket filler for a real estate of a funeral home. This guy right here. He said he asked a very specific question, and pay very close attention to how the doctor just didn't answer it. Look at this.
Older variants as well as Omicron may be ready in just.
Agencies could have done better.
All right, if I can, let me turn to the vaccines now. We've been told that a dual strain version, if you will, covering older variants as well as Omicron, may be ready in just a few weeks. Who will be the first in line? Is this essentially going to be a third booster?
Yeah, Lester, here's why the FDA has pushed us to build these vaccines. And the bottom line is that this virus has evolved substantially since the first vaccines were built. This is why we've seen waning immunity. The vaccines that are coming in a few short weeks are specifically designed for the virus that's out there. And I believe it's going to be available, and every American over the age of 12 will be eligible.
Will this mark the time to retire what we now think of as fully vaccinated, those initial 2 doses?
2 shots is not enough. People need at least 3. I think 3 provides that very high level.
I want to make sure that everybody's hearing this. Listen again.
Weeks are specifically designed for the virus that's out there. And I believe it's going to be available, and every American over the age of 12 will be eligible.
Will this mark the time to retire what we now think of as fully vaccinated, those initial 2 doses?
2 shots is not enough. People need at least 3. I think 3 provides that very high level of protection. And then just like the flu vaccine, where people need to get updated once a year, we probably need to continue to get updated with COVID vaccines on an ongoing basis.
All right, Dr. Ashish Jha, thank you for coming on with us tonight.
Thank you, Lester.
All right.
Give your business.
So there's that. What do you guys think about that? What do you guys think about that? Yeah, I got to agree with Emmanuel and DJ Elmo and Roots Trackers. I mean, he didn't even answer the question that the newscaster asked. So now here it says everyone over 12 is expected to be eligible for new boosters, White House official says. With updated shots coming soon, should you wait to get another dose or get boosted with the current vaccines now? That's the question. I guarantee you the article won't answer it. White House COVID coordinator Dr. Ashish Jha said on Wednesday that the newly updated COVID boosters will be available to teens and adults in a few short weeks. Now, here's my question. How many people even knew that this was going on? Remember, we talked about this. I told you guys they were working on new vaccines specific to BA4 and BA5. I told you guys that about a month or 2 ago. The question is, will they make you get it? Facts. What up with it, Volvo? I believe it's going to be available and every American over the age of 12 will be eligible for it. The new boosters target the Omicron subvariants, BA4 and BA5, as well as the original strain of the virus. Now, do you guys remember when BA1 and BA2 came out? And I said one of the things that is the issue that's going to be an ongoing issue with COVID is that it mutates too fast. So instead of putting concentration on coming up with new vaccines, what they need to try to do is come up with a way to either boost people's immunity to where the immunity will be able to recognize a generalized chemical within COVID, or what they need to do is continue to maintain the practice of mechanical removal through hand washing, hand sanitizer, recommending, not making it mandatory, but recommending wearing masks, recommending social distancing, recommending sanitation. You know what I'm saying? The issue with COVID is that it mutates too fast. It changes too quickly. Basically, the situation with COVID is that you have a lock, all right? And that lock can change. And you can't make keys in time to put the right key in the lock. That's the situation with COVID. Once you get a key made and you stick it in, it's already changed. Get a new key, stick it in, it's already changed. Get a new key, stick it in, it's already changed. Get a new key, stick it in, it's already changed. What you need to do is remove the door so that you don't have to use a key to open it, or break the lock off the door. Whatever you're doing with keys, I don't know how that's going to be effective in the long term. It's a very simple model and a very simple problem to solve, but they refuse to take the right approach. So now here it says BA5 accounts for 90% of new COVID cases in the U.S., according to Centers for Disease Control and Prevention. The Food and Drug Administration will determine how well the updated shots protect against the virus, Josh said, adding that he expects that they should work much better at preventing infection transmission and serious illness than the current boosters. Dr. Anthony Fauci, the White House chief medical advisor, told MSNBC's Andrea Mitchell on Thursday that he expects that the updated booster should provide stronger protection against any new variants that may emerge in the near future. Why would you expect that when every variant has had its own specific thing? BA4 and 5 are getting their own vaccine because they're variants that are different than the original. So why would you think that the differences are going to stop at BA4 and 5? See, this is what I'm saying. These are professionals, man. Dr. Fauci supposed to be an actual epidemiologist. He's supposed to be. That's what they said, at least. The reason why they're having so many issues with transmissibility is because the reconfiguration of the spike proteins every single time. That's one of the things that makes COVID unique. That's COVID's keynote feature, that it can change quickly. So now here it says, when should you get another booster? I mean, we know all of this information, so we don't need to go through the whole booster thing because all you got to do is just watch the video on boosters. Now, remember when we talked about the economy about a day ago, and I said one thing that I like to do is pay attention to what other countries similar to the United States are doing. This is what's going on in the UK. Okay. Hopefully this video will load. I don't think it will, though. We'll see. Moderna has a next generation bivalent vaccine that's supposed to be coming out. Next generation COVID vaccine that targets Omicron could be rolled out in autumn. So this is what's going on in the UK. This is what they got going on in the UK. Sounds similar to the United States, doesn't it? I thought we were two different countries. Well, are we now? The groundbreaking Moderna jabs, which target both the Omicron variant and the original strain of the killer virus, will be rolled out in a bid to avoid a winter NHS nightmare. All right. Now, this is a fairly new article. You see, today is August 19th. This article came out on August 15th. This is how behind in content that I am. This is how behind in content I am. A next generation COVID-19 booster jab, which is the first to target two strains of the virus, will be offered to millions of Brits over the autumn. Okay. The groundbreaking Moderna jab, which targets both Omicron variant and the original strain of the killer virus, will be rolled out in a bid to avoid a winter NHS nightmare. Around 26 million people, including all over 50 and younger Brits, deemed at high risk from the virus, are eligible for a booster jab over the autumn. Carers and those who live with vulnerable individuals will also be included in the rollout. The Medicines and Healthcare Products Regulatory Agency, MHRA, today announced it has authorized Moderna's new bivalent vaccine, with manufacturers say gives a big antibody boost that a dose may only be needed once a year. So they want you to do this every year, at least in the UK. The Medicines and Healthcare Products Regulatory Agency today announced it has authorized Moderna's new bivalent vaccine, which manufacturers say gives such a big antibody boost that a dose may only be needed once a year. Now, my question is, what's different with this one that is giving this big antibody boost? What's different about it? That's my question. What's so different about it that it's able to give this super boost? Real quick, ladies and gentlemen, we got 22 live viewers. Shout out and thank you to all 22 live viewers that are watching. And we got 24 likes. If everybody can take a moment and smash that like button and help us get to 46, that'd be awesome. So now here it says it is an updated version of the Moderna jab used in previous vaccine and booster rollouts. The original vaccine will also be used in the booster program. So now my question is, I want to know how many politicians worldwide have financial interests in Moderna. That's what I want to know. People that watch this video, leave that information in the comment section. Politicians, political organizations that have financial interests in Moderna. That's what I want to know. So now here it says today, the Joint Committee on Vaccination and Immunization announced that the new bivalent vaccine will be available to Brits in the autumn campaign, although it is not known to have been ordered or how much it has cost. It will be available to adults aged over 18 who qualify for a fresh booster, along with the original Pfizer-BioNTech and Moderna jabs. Vulnerable children under the age of 17 will be given a Pfizer-BioNTech vaccine with a pediatric formulation available to under 12s. Medics say that all of these are effective and urged for those who go for a booster to take the one they're offered. Following the approval of the new booster, MHRA Chief Executive Dr. June Rain described it as a sharpened tool in our armory. Dr. Rain said the first generation of COVID-19 vaccines being used in the UK continue to provide important protection against the disease and save lives. But you still run the risk of a breakthrough infection if you're dealing with BA4 and BA5. So now here it says it is expected that further vaccines will be developed and approved as scientists continue to get grips with COVID-19, which official data shows yesterday that has claimed 162,550 lives, including 827 in the previous week. Professor Wei-Shin Lim, chair of COVID-19 immunization on the JCVI, said all of the available booster vaccines offer very good protection against severe illness from COVID-19. As more vaccines continue to be developed and approved, the JCVI will consider the benefits of including them in the UK program. It is important that everyone who is eligible takes up a booster this autumn, whichever vaccine is in offer. This will increase your protection against being severely ill from COVID-19 as we move into the winter. So that's what's going on in the UK as far as COVID-19 goes. So my question for you guys is, what do you guys think about that? What do you guys think about that? Now, what's going on with monkeypox? Here's what's going on with it. Biden is accelerating monkeypox vaccine efforts. Treatment availability as cases continue to climb. Why are monkeypox cases climbing? That's my question. Why? What's the answer, guys? Why are the monkeypox cases climbing? Biden is accelerating monkeypox vaccine efforts. You guys remember any of those companies that make the monkeypox vaccine? Not a bad investment. Not a bad investment. I'll tell you what, they plan on doing all these tax breaks. That's what you should take your tax refund and do. Invest in the monkeypox vaccine company. And I agree with DJ Elmo. Yeah. Facts. What happens when Joe Biden decides to make his State of the Union address and he has monkeypox scars all over his face? What happens then? What are you guys going to do? What are you guys going to do? You know what I'm saying? They lucky they got Jen Psaki out of there. She's really bright. You know what I'm saying? The monkeypox bruises would have showed up all on her face. Had her looking like Domino from the New Mutants. Y'all remember Domino? I think she was, her and Cable was on one of them movies with Deadpool. That's how they'd have had her looking like a damn Dalmatian and shit. So now here it says Biden accelerating monkeypox vaccine effort. Treatment availability as cases climb. Top Biden administration officials are set to announce new steps Tuesday to accelerate the U.S. response to the spread of monkeypox amid high demand for vaccine and treatments. That includes boosting supply with an additional 1.8 million doses of Jynneos monkeypox vaccine, accelerating the U.S. Department of Health and Human Services vaccine distribution timeline. All right. So when this thing was first a thing, it would have been a good idea to invest in the monkeypox vaccine manufacturers. Remember, I was telling you guys that, hey, this is going to be a problem. Invest in the vaccine. That's what you want to do. You know what I'm saying? So hold on real quick, guys. Give me a second. I'm about to play this like this because I got to run and do something. So hold on real quick. See if this will work here. Let me see.
Support this work for $1 a month. By Betsy Klein, CNN. Top Biden administration officials are set to announce new steps Thursday to accelerate the U.S. response to the spread of monkeypox amid high demand for vaccines and treatments. That includes boosting supply with an additional 1.8 million doses of the Jynneos monkeypox vaccine, accelerating the U.S. Department of Health and Human Services vaccine distribution timeline. HHS will also launch a new program aimed at making vaccines available and engaging with at-risk communities at large events attracting LGBTQ communities. And the administration is pre-positioning doses of an antiviral treatment for individuals who test positive. The announcements come as the latest data from the U.S. Centers for Disease Control and Prevention says that more than 13,500 monkeypox cases have been reported in the United States, with more than 39,000 cases reported worldwide as of Wednesday evening. There have been 0 deaths in the U.S. Most monkeypox cases in the current outbreak have been linked to sexual activity. According to CDC guidance, monkeypox can spread to anyone through close contact, which is often skin to skin, as well as intimate contact that includes sex, hugging, massaging, and kissing. Men who have sex with men are at high risk of contracting the virus. In a briefing Thursday morning, HHS Secretary Xavier Becerra, White House monkeypox response coordinator Bob.
See, that's how you make some easy YouTube videos right there. That's how you make some easy YouTube videos. You know what I'm saying? You just turn on screen record and press that button and have it read the article to you, record it and post it on YouTube. There you go. Get you some money. You know what I'm saying? So let's see. Where are we at? Okay, yeah, here we go. So, yeah. So now look at this. The announcement comes as the latest data from the U.S. Center for Disease Control and Prevention says that more than 13,500 monkeypox cases have been reported in the United States, with more than 39,000 cases reported worldwide as of Wednesday evening. It's getting close to 40,000. Remember when we were reading this and it was only in the 10,000s? You guys remember that? There have been 0 deaths in the United States. Most monkeypox cases in the current monkeypox outbreak have been linked to sexual activity. So again, I mean, there we go. And not just any regular kind of sexual activity. Because I mean, I don't even, it's arguable if you can even call that sexual activity. You know what I'm saying? Shit. According to the CDC's guidance, monkeypox can be spread to anyone through close contact, which is often skin to skin, as well as intimate contact that includes sex, hugging, massaging, and kissing. Men who have sex with men are at high risk of contracting the virus. And notice where they put that. That's the last sentence. So, suspected case of human to dog monkeypox transmission. Why is that a thing?
First suspected human-to-dog monkeypox transmission leads to the Centers for Disease Control and Prevention to update its guidance. 2 men and their dog in France all tested positive for monkeypox. Scientists said in a paper published in The Lancet.
So what are you doing with the dog? Like this, like
first suspected human-to-dog monkeypox.
Like they just talk, like she's just reading.
First suspected
she's just reading this like it's all good and just not roasting anybody. What do you mean human to dog case? The hell your ass mean human to dog case of monkeypox? What are you talking about? They said that a couple men and a dog came up positive for monkeypox. What are you doing with your dog? They need to get the Animal Protective Agency over there. Don't no damn dog have no business having monkeypox. Yeah, they did some they did some. Yo, shout out to my man RG Titan. That's a crazy place to come into the video at, where RG Titan just came in. You know what I'm saying? Gotta be. Or they some black conservatives. Benjamin said they must have thought that if they kiss the dog, it'll turn into a princess. Shit, them was some men having sex with men. They wasn't looking for no princess. They was looking for the prince. They was looking for it to turn into a Lord Farquaad.
Dog monkeypox transmission leads to the Centers for Disease Control and Prevention to update its guidance. 2 men and their dog in France all tested positive for monkeypox. Scientists said in a paper published in The Lancet that the 4-year-old greyhound, which had no previous medical disorders, tested positive 12 days after his owners, reports The Hill. The CDC said infected animals can spread monkeypox virus to people, and it is possible that people who are infected can spread monkeypox virus.
Now, these people here, yeah, see, that's what they doing. They letting the dog lick their face. And if messed around and got monkeypox from his owners. Not a dog sitting there messed up and got monkeypox all over it. The dog don't know what to do. You know what I'm saying? And the owner's like, oh my God, we're going to have to put Fido down. You should have put Fido down when it jumped up on you and started licking your damn face. That's why it's got monkeypox, dummy. This is stupid and an unnecessary case of monkeypox. Now, as much as they want to get outraged about when those police dogs and shit get killed, I'm actually outraged about this because this is just an innocent bystander. This is just an innocent-ass dog. This is an old-ass greyhound just sitting around at the house, laying down, shitting all over the place, not doing anything else. You know what I'm saying? Barking and shit, waking people up. And the owners, you know what I'm saying, playing around, not wiping their toys off. And you know what I'm saying? Dog come up there, try to be nice. I'm going to lick your face. got the monkeypox. I don't let dogs lick me at all. I don't like that. You know what I'm saying? But if you got monkeypox scabs all over your damn face, I mean, that should be common sense. Don't let your dog lick the monkeypox. Come on now. They claim that the dog is man's best friend. Do that count if you have an alternate gender? You know what I'm saying? See, that's that. See, if I said, well, that's why that dog got abused because it's man's best friend, and it was living in a household with two individuals that don't consider themselves men, that's not politically correct. We took Fido to the vet because he's just so sick. He's scratching all the time. He's got these spots all over his skin. Well, he was licking my face, and you know, me and my partner, me and Danny, we both contracted monkeypox about a week ago. Well, don't have the damn dog licking your face. Don't have the dog licking your face. You're supposed to be in quarantine if you have monkeypox. That includes not having your dog lick your face or your nuts or your ass, wherever the hell the monkeypox were and whatever the hell you were doing. Sheesh. Because we're just assuming we're just assuming that they were licking his face. You know what I'm saying? We read that report from the New England Journal of Medicine, and it talked about how the lesions are located in the quote anal genital region. You know what I'm saying? So, you know, who knows what was going on? Does any
to animals through close contact. Those infected are advised to avoid activities with their pets, including petting, cuddling, hugging, kissing, licking, sharing sleeping areas, and sharing food.
See? See that?
Petting, cuddling, hugging, kissing, licking, sharing sleeping areas, and sharing food.
Ugh. Oh, God. Mm-mm. Man, where's Captain Obvious to save the day when you need him? You know what I'm saying? They need to make Captain Obvious like a bat signal or something so he can come and save people. So now here it says in a briefing Thursday morning, HHS Secretary Xavier Becerra, White House monkeypox response coordinator Bob Fenton, and CDC Director Dr. Rochelle Walensky will announce that HHS has accelerated phase 4 of its national vaccine strategy and will be making an additional 1.8 million doses available for ordering starting on Monday. The White House said in a fact sheet obtained first by CNN. That accelerated allocation phase will give states and jurisdictions more visibility into how much of the vaccine to expect as they make plans to distribute it. The Biden administration is also providing more resources to local jurisdictions to help transition to the new type of injection to stretch out vaccine supply. The administration is encouraging states to provide the Jynneos vaccine intradermally. Now, here's my question. I want to see if you guys, how you guys' memory is. Do you guys remember why they're encouraging states to provide the Jynneos vaccine, quote, intradermally? Why are they doing that? You stupid DJ Elmo. Yeah. You crazy as hell. Literally, who is literally is the tail wagging the dog. Yo, that's crazy. Oh shit. Damn. Oh man, that's funny as hell, man. Damn, that's funny. So I got a question for everybody before we get back to this article. How many people are subscribed to the channel called Auditing Africa? If you guys are subscribed to Auditing Africa, give me a thumbs up. If you're not subscribed to Auditing Africa, give me a thumbs down. TJ almost said not being funny. Bro, that was funny as hell. All right, cool. Because I think I might do a stream about some stuff on that channel shortly after I'm done with this one. If somebody could, if there's any moderators in the chat, if y'all could put the link in the chat for the Auditing Africa channel for Al, that would be great. Because they didn't like shots in the butt. Now, you know they like stuff in the butt. That's definitely not the problem with this particular crowd. They not turning down anything in the butt. If they would turn down anything in the butt, we'd probably see a decrease in the transmission. Nah, the reason why they made it intradermal is because they're able to use less of a vaccine amount for the same dose. So if they administer it intradermally, they can use a smaller volume of it. You see what I'm saying? So like, say for instance, if they did it IM, if they did it intramuscular, or if they did it sub-Q, arbitrarily, let's say it'll be a millimeter. They'll use a milliliter of the vaccine solution. You can get the same effect by using a half milliliter intradermal. So they're doing it to spread the amount of vaccine. See, so what happens is if you use that same ratio that I just used, one bottle would provide double doing it intradermally. So that's why they're doing it. There we go. So everybody, if you're not subscribed to Auditing Africa, make sure you take a moment and subscribe. Shouts out to my man DJ Elmo. He just put the link in. We're gonna talk about some things on that channel, I think. So now here it says Los Angeles County in California and Fulton County in Georgia have both switched over completely to the intradermal vaccine. A White House official told CNN, as the administration is providing technical assistance, support, and resources to jurisdictions in the process of adopting and expanding intradermal administration. The officials, look at this. The officials will also unveil a new program aimed at reaching the populations at highest risk, gay and bisexual men, who have made up the majority of confirmed cases so far. So now, like, this is what I'm talking about. I don't even want to, I'm not even going there. But there it is right there. Yeah, they're cutting corners. Exactly, Val. I agree. What up with it, Shatera? Shatera came in with the mask on. See? She knows what time it is. HHS is launching a pilot program to provide additional vaccine allocations to state and local health departments in jurisdictions that are hosting large events that attract gay, bisexual, and other men who have sex with men in the coming weeks and months. In my opinion, it seems like we need to have in-services about dogs. Oh, yeah, for sure, Ben. Yeah, you can definitely do that. If you go to the channels section of my page, I think the channel section should have a Cash App on there. Appreciate it. So now here it says the fact sheet said that adding 50,000 doses from the strategic national stockpile will be set aside for this purpose. So there you go right there. HHS is launching a pilot program to provide additional vaccine allocations and local health departments in jurisdictions that are hosting large events that attract gay, bisexual, and other men who have sex with men in the coming weeks and months. Here's my question. Now, you guys might laugh. Y'all always laugh. look, Shatera said, I saw that. How Fido get the monkeypox, child? Look, I bet Shatera sound like the intake nurse. Shatera sound like the intake nurse at the vet when they took the dog to the vet. How Fido get the monkeypox, child? I don't know. He just was sick one day. Like, man, you know how he did it. You know how he got it. You just don't want to explain because that shit's not safe for work. You know what I'm saying? Shit. You just don't want to explain because that shit is not safe at all for work. What do they plan on doing about monkeypox in the prison system? I mean, I'm not trying to be funny, but I could definitely see that being a problem there, particularly the male side. I don't think that anybody's said anything about that, but just wait, just watch, just wait. Man, it's going to be all kinds of monkeypox running wild in prison. Kissing a dog all in the mouth. Ugh. I don't think that's how they got it, for real. I think the dog was licking somewhere they don't want to talk about. Well, usually what happens, you know, we live in New York City, so the budget is it's really expensive here. So sometimes we have to cut corners on certain things, and sometimes I just can't afford Charmins. So when I get done on the toilet, usually Fido takes care of that for me. There's nothing like taking a nice, healthy number 2. Fido, we're out of toilet paper this week. That'll get your dog monkeypox. That'll get your dog monkeypox. You should have never put Fido in that position. And you don't need to follow that up by telling me all the positions you like. Just listen sometimes. You know what I'm saying? Look, would you have started acting like you weren't texting, but acted like you were texting while you staring at them? Well, what are you staring at? Nothing. Text message going out. Girl, these 2 motherfuckers came in here with this dog with monkeypox. Are you texting about me? Nah. That's funny as hell. So now look at this. It says one of the upcoming events is the Charlotte Pride Festival and Parade this weekend in North Carolina. Officials acknowledge that this effort will not prevent spread around these events since the vaccine does not provide full immunity until 2 weeks after the second dose. But it is an effort to raise awareness and meet people when they are there. I just don't understand what happens at these events where there's so many body fluids splashing all over the place. Like, I just don't understand. I mean, I've been to parties before and it just, you know, there's just not a constant spray of body fluids all over. Maybe I've been going to the wrong parties. I don't know. But then again, maybe I've been going to the right ones. I don't have monkeypox. You know what I'm saying? So now here it says the CDC is also offering assistance and support to jurisdictions to prepare for these large events, including helping develop vaccine testing strategies to be stood up in around these events, developing tools for information gathering from event participants and providing messaging and communication resources on the vaccines, testing, and strategies to reduce one's risk of contracting the virus, the fact sheet said. I'm about to buy a vaccine truck. You know how they got the you know how they got food trucks? I'm finna buy a vaccine truck. I'm gonna go right up to one of them events. We got the monkeypox vaccine, we got C19, we got the new variants, we got them all. Open up the trunk, just like how they used to sell CDs back in the day. You got all the syringes pre-dosed and lined up. You know what I'm saying? Oh my God. HHS Administration for Strategic Preparedness and Response will make available 50,000 patient courses of TPOXX to jurisdictions next week, the fact sheet said. That allocation will rely on a formula based on 75% of the number of cases in a jurisdiction and 25% of the number of individuals at risk. All right. So there it is right there. There goes the monkeypox places. You see, they got the LGBT. See, like, there's an area around where I live at that's the LGBTQ neighborhood, enclave type area. It's just like that right there, where they got the flag out on the street poles. You know what I'm saying? It's been like that for a long time, though. That little area by where I live at, it's been that way long before, like, it was cool. You know what I'm saying? Long before people was like, oh, yeah, I'm LGBTQ. You're not? What's wrong with you? Way before it was like that. You know what I'm saying? C19 Bigo. We got the ones for BA4 and BA5, 50% off. Open up the trunk has a double meaning. Yeah, open up the trunk. Open up the trunk could get you monkeypox. You know what I'm saying? I want to get a bumper sticker that says "Stop the orgies." Matter of fact, I'm finna make one. That's finna be. You know what? Y'all need to smash the like button on this video and also make sure that y'all share this video out. You know what I'm saying? Because we got to get this channel here to 10,000 subscribers so that I can have a merch store. Because I'm finna get that bumper sticker and it's gonna say "Stop the orgies." And it's gonna have a whole bunch of people piled on top of each other, and then one person holding up a stop sign. We can make it a shirt too. Stop the orgies. Stop the spread. Or we can have somebody bent over, you know what I'm saying, with a no smoking thing, you know, the no smoking circle over it, bent over, spreading their ass cheeks, and on the shirt have it say "Stop the spread." I think that'd be a good one too. You know what I'm saying? Like my man Grind and Motivate said, they'd be tooted up, spreading. You know what I'm saying? With the no smoking thing around them. Stop the spread. Because we care. You know what I'm saying? And we love everybody. Yeah, the freaky shit out here killing people. Freaky shit out here putting people down. You know what I'm saying? It's out here putting people down. Look at this. Now, yeah, in Spain, I think they got 2 deaths, if I'm not mistaken. This is a picture that ABC actually used from Spain. Release the vax. Yeah, let's not and say we did. I had said that, Kareem, put the vaccine in the lube and call it Vax Wax. That's a fact. Vax Wax. Look, you remember how they used to call you remember how they used to call the TV the boob tube? We can sell Vax Wax in a jar, just like how they sell the Dax Wax for your waves, and then we could sell the Vax Wax jelly in a boob tube. I don't know why this should be having me dying laughing, man. This shit crazy. Who's seen that movie Boiler Room? Y'all remember when Vin Diesel told that white dude? Y'all remember when Vin Diesel told that white dude, yeah, maybe you want a little bit of tube steak smothered in underwear. Ah. Damn. Why can't you stop the orgies though? You know what I'm saying? I don't understand. I mean, you have all these orgies and then you got somebody in here looking like this with all this 3M beehive beekeeper equipment coming on in there to check you out. Like, the fuck? This motherfucker look like he about to go get some honey from a bee's nest. But he's actually about to go get honey from something else that's sweet. Oh man. You remember Chris Tucker on Chris Tucker on Fifth Element? Bzzz. Oh man. They're lining up for the monkeypox vaccines. Give me mine in my arm. Motherfucker be trying to act all funny. I don't want it in my butt. This is the first time you ever said some shit like that. Now, something that's gonna keep something that's gonna keep you alive. You don't want that in your butt. You know what I'm saying? But you'll stick everything else up there. Like, come on now. What kind of sense do that make? You know what I'm saying? You don't want something that's gonna save your life up there, but you know what I'm saying, you gotta take everything else up there. Okay. All right. Y'all making y'all making bad choices out here. Oh man. So shout out to my diabetics. There's a diabetes tablet that has been found to have a carcinogen in it. And guess who makes it? Merrick. And if you guys remember who Merrick is, Merrick makes ivermectin. You guys remember ivermectin? Joe Rogan? So Merrick is the manufacturer of ivermectin. They also are the manufacturer of a medication called Januvia, which is a pill for diabetes. It's been found to contain a potential carcinogen. Now, you guys know what carcinogens are. Those are chemicals that can be linked in many cases, in many cases to cancer. I wonder if any of that is contained in the ivermectin. Who knows? The FDA said it's working to avoid shortages of the drugs. All right. So let's see what this says. Now, see, my Bloomberg subscription works on this computer, but on the other computer, for some reason, it don't. American company's Januvia, which is a popular diabetes drug, was found to be contaminated with a potential carcinogen. Look at this. An impurity called nitrosamine was found in samples of the drug, which has the chemical name sitagliptin. Sitagliptin, the U.S. Food and Drug Administration said on Tuesday. All right. So they found a carcinogen called nitrosamine in Januvia. Januvia is a pretty popular diabetes medication too, a pill. You know what I'm saying? It's not as popular as metformin. You know what I'm saying? It's not as popular as glipizide, but you see Januvia a lot. People use Januvia. It's out there. It's definitely out there. The agency said it was permitting Merck to continue to sell drugs containing sitagliptin with higher than allowed levels of nitrosamine in order to avoid shortages. That's nice. I mean, so what the hell they plan on? I mean, do they plan on doing anything? Shit. Look at this. The agency, which is the Food and Drug Administration, said it was going to permit Merck to continue selling drugs containing sitagliptin with higher than allowed levels of nitrosamine in order to avoid shortages. So how are we going to avoid this? How are we going to deal with the shortage? I'll just go ahead and keep selling that shit with the cancer-causing agent in it. What? Does that make any sense? I mean, do they plan on warning people at least? I mean, do they plan on warning people? Why not getting people on some kind of alternative medicine until they get the contaminant out? I mean, to me, that would make a little bit more sense. Real quick, ladies and gentlemen, we got 22 live viewers. Shout out to all 22 people that are watching, and we got 26 likes. If everybody can take a moment and smash that like button and get us to 48, that would be amazing. Help your boy out and smash that like button. What do you guys think about that? They're going to go ahead and continue to sell the medication with the cancer-causing agent nitrosamine in it. And they're doing it because we're going to say we don't want to cause a shortage. That's an interesting way to deal with that. Merck confirmed in an email that it recently detected nitrosamine identified as NTTP in some batches of our sitagliptin containing medications. The company is working with health authorities around the world and has put in place additional quality controls to make sure the drug meets the FDA's interim limits. Merck confirmed it found NTTP in 3 drugs that contain sitagliptin: Januvia, Janimet, and Steglajuan. Nitrosamine levels in a related extended release therapy, Janumet XR, were too low to be measured, Merck said. Januvia is Merck's, look at this, Januvia is Merck's best-selling drug with $3.3 billion in sales last year, according to Bloomberg data. Janumet had revenue of almost $2 billion last year. Diabetes is a big business. You guys see how big of a business diabetes is? What do you guys think about that? Diabetes is a pretty big business. So now here it says sitagliptin used to control high blood sugar in patients with type 2 diabetes is one in a string of medications found to be contaminated with nitrosamine since 2018. Now, here's my question. How many people have heard about any of the nitrosamine contaminations starting in 2016? Oh, my. Well, what do you know? Pfizer had one. Look at that. Pfizer had one. Yeah, you can manage type 2 diabetes on your own. In some cases, you may need a little bit of intervention. You may need a little bit of insulin. You may need an oral medication like metformin or something like that. But in most cases, you can manage it on your own. In most cases, you can prevent it if you pay attention to your labs and you eat healthy. Another popular diabetes drug called, look at that, metformin. That's the most popular one. Was among those affected with certain blood pressure pills and Pfizer's smoking cessation drug Chantix. And I heard Chantix actually works, but I mean, no wonder it works, because instead of the cigarettes giving you cancer, the medicine gonna give you the damn cancer. So metformin is out here causing cancer because of nitrosamine. 4 years ago, pharmaceutical companies discovered that some blood pressure pills were tainted with N-nitrodimethylamine, or NDMA, kicking off years-long examination of commonly used medications that uncovered several instances of contamination. So now, here's my question. Is there reason for people to have some kind of suspicion about medications and different things like that that they take into their bodies? I mean, is it justified, or are people just being extra? I mean, clearly, right here, this is definitely making a case for people being somewhat scared. This is definitely making a case for, people having suspicions. So now here it says NDMA can likely increase the risk of cancer after prolonged exposures at the levels detected in the drugs. Merck's shares fell as much as 1.9% following news of FDA statement, but recovered to gain 1.2% at the New York close. The nitrosamine discovered in sitagliptin is called nitro-STG19, or NTTP. Although there are no data available to directly evaluate the carcinogistic potential of NTTP, FDA used information available on closely related nitrosamine compounds to calculate lifetime exposure limits for NTTP, the agency said. The FDA allows 37 nanograms per day of nitrosamine in a drug, though it is allowing up to 246.7 nanograms in sitagliptin to avoid shortages. That's a huge increase. Are they out their goddamn minds? That's that's almost 8 times the amount. And they're saying that they're allowing it in order to avoid shortages. Do you guys think that that's the best way to deal with this? If you guys think that this is the best way to deal with that, give me a thumbs up. If you don't think that that's the best way to deal with it, give me a thumbs down. The agency said that its calculations show the difference in cancer risk is minimal. We remain confident in the safety, efficacy, and quality of our sitagliptin-containing medicines, Merrick said. No significant impact on supply of these medicines for patients is anticipated. The FDA recommended patients continue on their sitagliptin drugs until they talk to a healthcare provider. The FDA recommends prescribers continue to use sitagliptin when clinically appropriate to prevent a gap in patient treatment, according to the agency. All right. So, people who are diabetic, if you take oral glycemic control medications, if you take metformin or if you take Januvia, just be aware, because the FDA is allowing 8 times the amount of a known carcinogen in there temporarily to compensate for a shortage that could possibly happen because Merrick is selling contaminated products. I don't know how good of a strategy it is, but it's not what I would do to deal with that. So, ladies and gentlemen, players and pimps, I hope you guys enjoyed the stream. If you're not subscribed to the channel, you already know what to do. Make sure you smash that like button. Make sure you hit the bell. Make sure you share the videos out and tell a friend. Also, if you guys have not subscribed to my backup channels, take a moment. Make sure that you hit the backup channels. Always watch the videos when they come up on your home screen all the way through to the end. And I will catch you all on the next video. All right? Peace.